We welcome the Reverend Luke Choi, church consultant with the Presbyterian Board of Pensions. Welcome, Luke.
Thank you, Madam Moderator. Good afternoon, everyone. I am your new friendly neighborhood church consultant, Luke Choi. When Budget and Finance Committee gets no question, I take that as a sign that you really want this meeting to end sooner than later. So I am going to cut to the chase and dive right into introducing some of the new benefit changes in 2022. So I'm going to share with you my screen here. Okay, I'm hoping that everyone can see the screen. And for whatever reason, if the screen, if my PowerPoint doesn't change, please let me know. Now, starting on April 1st, all medical plan members, except Medicare supplement plan members, will be offered a new feature called Care Navigation, which is provided by the board in partnership with the healthcare navigation expert called Quantum Health. And you've probably been getting a lot of probably emails and mail about Care Navigation. Through Care Navigation, members and their cover family members will have access to their own personal support team of nurses, clinicians, and benefit specialists to make your healthcare experience simpler, easier, and more effective at no additional cost to members or employers. Dedicated Quantum Healthcare coordinators will be your one-stop customer support throughout your healthcare journey to help you receive right care at the right place at the right time. Now, members still have access to the same Blue Cross Blue Shield National Provider Network, which is the largest and one of the best in the nation. Also, Express Scripts will continue to administer prescription drug benefits for you. However, instead of calling Highmark Blue Cross Blue Shield or Express Scripts customer service when you have a question about your medical or drug benefits, you will now call Quantum Health. Now, you will get a new ID cards, medical ID cards, and your prescription drug ID cards, and it will have the new phone number on the back of it. Quantum Health will be members' primary point of contact for questions about medical or drug benefits. So with Care Navigation, members have one number to call for understanding and using their medical, behavioral health, and prescription drug benefits. And as you can see from the screen, that's some of the, some of the things that Care Navigation will be able to do for you. And keep in mind that you can choose to engage with Care Navigation as much as, or as little as you like. But if I were you, I'd take advantage of this great service. The care coordinators will get to know you. They'll know your medical history. They'll work behind the scene with your service providers, including doctors and hospitals, so that you won't have to spend so much time and energy navigating through today's complex healthcare process. Now then, you may ask, well, what stays the same? Well, the Medicare, as I've told you, mentioned before, Medicare supplement plan members will continue to contact Highmark Blue Cross Blue Shield for customer service, because Care Navigation won't cover Medicare supplement plan members. Also, members with dental, vision eyewear, flexible spending accounts, and health savings accounts, and the retirement savings plan will continue to contact those service providers. You may also ask, well, what does that leave for the board to do? Well, we're still your primary point of contact for pension, Medicare supplement plan, term life plan, and death and disability plan, including supplemental death and both temporary and long-term disability plans. Now, speaking of temporary disability, If you are unable to work for more than 14 consecutive days while recovering from an injury or illness, such as COVID, you should consider applying for temporary disability benefits because your employer is really paying for it. And we've been lately getting a lot of calls from folks who are suffering from COVID, and they're unable to work for extended period of time. I'm going to tell you that it's you should know that it's the member, not the church employer, but it's the member who must apply for this. And you have 30 days from your first day of absence from work due to your disability to apply. So you shouldn't wait too long to apply for it, even though your church is probably kind enough to support you through your leave of absence. Temporary disability will provide 60% of your effective salary, and it is paid weekly. And this benefit can be available for up to 90 days from the date of disability after a 14-day waiting period. And by the way, for planned absence, for example, elective surgery such as knee replacement or hip surgery, where you're going to be absent for an extended period of time, you may even apply in advance, up to 30 days before the first day you are absent from work. Now let's talk about some changes for those of you who are enrolled in Medicare supplement plan. As I mentioned earlier, Quantum Health will not serve the members of Medicare supplement plan. So the board, in partnership with Highmark Blue Cross Blue Shield, is still your main source of customer service. As of 1st of January, Medicare supplement plan members will now have a vision coverage at no additional charge, which can save hundreds of dollars on out-of-pocket costs for glasses, contacts, and eye exams. Major retail chains like Walmart, Sam's Club, Costco, and Pearl Vision are included in your network, which is VSP. And this Vision eyewear plan also has great discounts on popular lens enhancements and extra glasses. Also, as of 1st of January, Medicare supplement plan members can enjoy the Employee Assistance Plan at no additional charge, which gives you access to counseling sessions, financial and legal assistance, resources for child and elder care, and more. You may have heard about a federal requirement that all health plans provide 100% coverage for up to 8 over-the-counter home COVID-19 tests in a 30-day period, effective January 15th. Now, the Board of Pensions has been working closely with Express Scripts to ensure our medical plan complies with this requirement. So, starting February 1st, simply present your prescription drug ID card when buying FDA-approved over-the-counter home COVID-19 tests at the pharmacy counter of a participating Express Scripts pharmacy. You won't be charged anything as long as you don't exceed the 8-test limit in a 30-day period. Also, don't forget that every home in the US is eligible to order 4 free at-home COVID-19 tests, which is separate from the 8 per cover member or dependent per month allotted by our plan. Let's turn our attention to assistance program. Through assistance program, the Board of Pensions provides need-based grants to help active and retired ministers, lay employees, and their families who are members of the benefits plan. We made a number of changes to the assistance program this year to reflect our goal of serving more, serving better, serving the church, which means more people will be eligible for our programs and will receive higher amounts of grants. I've broken down the assistance program to 3 categories, one pertaining to all active and retired members, and then one that only applies to retired members, and lastly, one for active minister members only. So let's talk about one that applies to all active and retired members. You have adoption assistance grant, which will help you pay for some of the adoption cost. And it has increased from $3,000 to a whopping $6,500 per child this year. Also, transition to college assistance grant increased to a flat amount of $2,000 to support any dependent child who is in any post-high school education or training, full-time or part-time. And you get additional $1,000 if your child attends a Presbyterian school. Don't forget the emergency assistance grant. It's not on there, but it's a one-time grant that addresses an emergency or unexpected need facing an individual member or groups of members. Out of all the assistance grants we offer, I would say this one may have the widest and most pliable eligibility criteria. The amount awarded vary with need, and it ranges from a few $100s to $5,000 each. Next, the programs for retirees, their spouses, and their surviving spouses who are 65 and older. Housing supplement. Housing supplements help eligible retirees to remain in their homes or move to retirement facilities, and they're paid out monthly. Both housing supplements and income supplements run for the duration of retired members' lives unless their financial circumstances change. Now, the good news is that required number of years in pension plan for both housing supplement and income supplements has been reduced from 20 to 15 years with up to 10 years service credit. Now, this means that let's say you've been working, serving at a congregation, employed by the congregation for 5 years with plan, but then for, let's say, more than 10 years, the church couldn't afford you the plan, so the benefits plan, so you were not participating in the plan, but you did serve the congregation, but without the plan. Well, we will count those 10 years of service towards that 15-year requirement, so eligibility requirement, so that with the 5 years that you have the pension plan, and then 10 year of the service credit, that you will have that 15-year requirement to be qualified for your supplement and income supplements. And also, don't forget about retiree medical grants, which reimburses eligible retirees and their spouses or surviving spouses for dental services and hearing aid expenses of up to $2,500 per person once every 3 years. Now, for this grant, you do have to have 15 years in the medical plan or in the defined benefit pension plan, which is still down from 20-year requirement from the previous years. Lastly, let's talk about assistance programs that have to do with the ministers in active service only. This year, we have a new program called Minister Debt Relief. This program provides grants of up to $10,000 for any personal debt for those who qualify. And then, of course, we have a minister educational debt assistance, which helps eligible ministers repay educational debt through financial coaching and grants of up to $25,000 over 5 years. And lastly, sabbatical support grant, and which provides Sabbath grants of up to $4,000, which is up from $3,000 in the previous years. The Board of Pensions offers a number of benefits options and programs that are very small church friendly and may apply to both clergies and non-clergies regardless of their employment status. First, small congregations with limited financial resource should consider Pathways to Renewal. Pathways to Renewal program reduces pastors' participation dues nearly in half, from 37% of effective salary to 21%. To qualify, a congregation must have 150 or fewer members and not had an installed pastor for at least 2 years and not yet elected a pastor nominating committee. Or, you could be a congregation of any size. You could be like 1,000-member congregation or 1,500 member congregation. You would still be qualified for pathways to renewal if you are looking to expand ministerial headcount, meaning that you're looking to add more ministers, associate pastors, perhaps, to your ministerial headcount. The minister being called through pathways to renewal just has to be under age 40 and be either a candidate for ordination or an ordained minister of the word and sacrament, and not have been previously covered under pastor's participation in the benefits plan, and he or she may be both installed and non-installed. The board also offers several benefits options for employees regardless of the work hours and clergy status. These benefits can be offered to any employee at little to no cost to the employer. Dental plan, retirement savings plan, dependent care flexible spending accounts, and vision eyewear plan. These are great plans, and any employee would qualify for this. And small congregation may also consider hiring a retiring minister who is collecting his or her pension benefits, because it could be a great option since you're getting an experienced leader and save money because you won't have to pay for his or her benefits. However, please be aware that if a retired minister is serving more than 20 hours per week, the church will be assessed post-retirement service dues of 12% on the minister's effective salary. If you have any, I know this is a lot of information, and if you have any questions, please feel free to email me at lchoi@pensions.org, or you could call me at 609-575-6321. That's my personal cell, and I am literally available 24/7. So unless I'm in the middle of the meeting, I will answer your call. So please feel free to reach out to me if you have any questions. And that concludes my report, Madam Moderator, and thank you once again for your time.